Hello, everyone. My name is Layla Burke, and my etiology presentation is on infectious mononucleosis. So this presentation will just be an overview of that, which is also called the Epstein-Barr virus. And I chose to do my presentation on this because I have had mono 3 times, which is rare. People usually only have it once. So yeah, I will just be going over mono. So an overview, the common name is infectious mononucleosis, and then the binomial name is Epstein-Barr virus, and in the name, the pathogen type is a virus. So this is in the herpes viridae family, and then the genus is lymphocryptovirus because it affects the lymph nodes throughout the body. And then the shape of this virus is spherical and it's enveloped. So this virus is endemic, which means it circulates continuously in populations. It is not associated with pandemics, but it is globally widespread. As you can see in this picture I have here, this just shows the growth rate by region of mononucleosis. So it is, I'll talk about this more, but it's most common in adolescents and adults. So just a little bit about the history. The first recognized cases were documented by a man named Sir Michael Farquhar in 1889, and then in 1964, researchers discovered that the Epstein-Barr virus may be the primary cause of infectious mononucleosis. So the illness was not associated with a specific cause at first, and then in the 1970s, Epstein-Barr virus was confirmed as the cause of mononucleosis, and then diagnostic tests were developed. So studies just linked the virus to the development of infectious mononucleosis, and then monospot tests were developed, which I'll talk about more later on. So the transmission of mononucleosis, the main transmission is through saliva. So this would be kissing or drinking / eating after others. And this is the primary transmission. And then blood transfusions and organ transplants are the secondary transmission of mono. And then sexual contact is less common, but it is a transmission. And then the symptoms of mono are fever, sore throat, fatigue, swollen lymph nodes, muscle aches, and headache. And then treatment could be supportive care such as rest, hydration, and then fever and pain management. So you can also use ibuprofen or acetaminophen. And then corticosteroids are prescribed in severe cases where maybe the airway is obstructed. And then there's no specific antiviral therapy. So this is just a chart of the main symptoms of mono, which I already talked about before, but one of the symptoms, you start off having fatigue. I know when I had it, I didn't know I had it, and I just noticed that I had like golf ball sized lymph nodes on my neck, and I had just been noticing that I was really fatigued. And when I went to the doctor and got tested for mono, they said I had it for 2 weeks, and I just didn't know. So yeah, and then the spleen will be enlarged, and the Epstein-Barr virus causes the spleen to produce more mononuclear cells that is why it is enlarged, and then it can cause abdominal pain. And then the tonsils will probably be swollen and red and have little white patches. So there are lots of signs to be on the lookout for if you think you have mono. So who is most at risk? Infectious mono primarily affects adolescents and young adults, ranging from ages 15 to 24. And this makes sense because this age group is the age group that's going out more. And, for example, when I got mono in college, I contracted it at the school's cafeteria. So in this picture just shows how easy it can be to get mono. These two girls are sharing what looks like a smoothie or milkshake, and they're using separate spoons, but still saliva can just be transmitted easily, even if it's not just through kissing, because mono is known as the kissing disease. And then for the diagnosis, the symptoms are, as I said before, sore throat, fever, swollen lymph nodes, and fatigue. And then for a physical exam, you'll see that the tonsils are enlarged, sometimes with white patches, and then the spleen or liver is enlarged. So if the doctor thinks you have mono, they'll often feel around the area where your spleen and liver are and just see if there's any pain, or they can usually tell if it is swollen. And then the laboratory test, the monospot test, is a rapid test that detects heterophile antibodies. And then EBV specific antibodies are IgM and IgG antibodies that can confirm infection. And then a complete blood count is also a common test, which just will show elevated white blood cell count with atypical lymphocytes. So, like I mentioned before, treatment, rest, hydration, pain relievers, steroids, and then splenic care, which would just be avoiding contact sports, because if you are hit during a contact sport, the spleen could very easily rupture. And then the current impact of mono, it affects up to 90% of people worldwide by age 40, so just that younger age range, but most people will have it at some point. And then chronic fatigue syndrome can occur after having mono for a while, which mono usually will last 2 to 4 weeks, so it can last up to a month, but there could be chronic fatigue for even months or years. So then also secondary infections could occur from mono, such as strep throat or tonsillitis, just because an individual with mono will be immunocompromised. And then, like I said before, splenic rupture is rare, but could be a serious complication. And then here are my citations. Thank you for listening to my presentation.